Uh, so, friends, I have a great honor to introduce Dr. Niru Prasad, who is not just a person from the sector or from a professional, a doctor, but also a very long time ardent donor and supporter of Sense International India. Almost 20 years ago, I think it was
Around
2006.
there.
She
Around there.
Yes. Niru ma'am set up an endowment fund in memory of her father and mother, in memory of her parents, to support work in Bihar for children with deaf blindness and other disabilities. So this is one of her introduction. The other introduction is that she is a medical doctor. She has more than 30 years of practice in terms of pediatrics and emergency medicine. She has worked in the Children's Hospital of Michigan, and also she is fellow of both the American College of Emergency Physicians and American Academy of Pediatrics. This is a great achievement and honor. And डॉक्टर प्रसाद बहुत सारे सीनियर स्टाफ जो फिजिशियंस होते हैं उनके साथ जुड़ी हुई हैं। हेनरी फोर्ड हॉस्पिटल है उसके सेंटर के साथ जुड़ी हुई हैं। सेंट जोसेफ मेर्सी हॉस्पिटल इन पोंटियक उसमें जुड़ी हुई हैं। ब्यूमॉन्ट हॉस्पिटल इन रॉयल ओक मिशिगन उसके साथ जुड़ी हुई हैं। और इस मेडिकल काम के अलावा शी इज़ अ वेरी पैशनेट एजुकेटर and author. She has also authored many books. We are grateful to Niru ma'am that she has provided us those books. The e-copies are available on our website as well. And she is also a media personality. She has given talk shows on health, on TV, also on radio. She has been a radio host as well. Her major work has been on health, major works on covering topics such as child abuse prevention, depression, safety awareness, and even today she visits the schools across Michigan to inspire students to pursue science and health as career. So in her recognition, the work she has done and for her contributions, she has received many awards, including the famous AMA American Medical Association Physician Recognition Award and the Lifetime Humanitarian Award and induction into the Heritage Hall of Fame in Detroit. So we have a great person amongst us who is very ground to earth person, very approachable. And ma'am, the audience here is we have a mixed audience, people who are from special education, there are therapists, there are heads of the organizations. So we are very grateful for your time. Over to you, ma'am.
Good morning, Akhil, and thanks a lot for your introduction. We have known each other for such a long time. It is a pleasure to see you. And I was very happy, and I'm thankful to all of you that you invited me for this webinar. And this is about the disability and the cerebral palsy among children. This is a very interesting topic. It's a very interesting topic. Anji, can you help me? Can you hear me?
Yes, ma'am,
Yes,
we
ma'am.
can hear
We
you,
can hear
and
you.
Okay,
your
so what
presentation
it
is
is,
also.
last month, yeah, cerebral palsy. There's a lot of work has been done through the disability, and the federal government has given lots of money to the Academy of Pediatrics. So all these babies, when they grow up, they have some kind of means to live. And March is supposed to be here, Disability Awareness Month for cerebral palsy. So what I did in order to make things simple, I just prepared a series of slides so I can explain to them the simple way of what cerebral palsy is. especially the early recognition among when they are born. That is a crucial period when the revival should be done with the facts in mind that this baby is not a normal baby. So I request Richard to kindly connect me with some slides, and then I can share it with our
Yes, ma'am.
audience.
Ma'am, the slides are visible on the screen for us. So we are on
Okay.
the first slide, which is the title slide. The second
Okay,
slide.
yeah. So cerebral palsy, this is a group of neurologic disorder that affects the body's muscle tone, and mostly the reason it happens is there's an injury to the brain before developing brain, and it could happen before during birth, after birth, or during the late pregnancy period. And I do remember working in the neonatal units and children's hospital. I used to be called by the nurses because there's delivery happened, the baby is not breathing or the slow breathing. And I'm talking to you during the late 19 and early 20, where we did not have that much equipment to survive these babies. Now, with the modern advances in the science, there has been so many interventions that is being done to resuscitate these babies. Next slide, please. So anyway, I put this picture for all of you to see the structure of the brain of a baby, and you can see the red one is the cerebellum part in the bottom, and that part is not developed. Similarly, on the top, the frontal lobe, the cerebral cortex, those are the poorly developed areas in the babies when they are born. And according to that, what happens, these babies, because of the poor cerebellum, they don't have muscle tone coordination, and they have a weak cry. And you know what, I still remember how we used to save those babies. When the babies are born, we we resuscitate, try to, during the process of resuscitation process, we hold the baby and just pat the back. There are two kinds of the palsies. One of them is loss of muscle tone and all, and that is the floppy baby, very soft. When you hold it on the trunk, their head droops down, and so the leg. Another one is spastic baby, that 80% of the cerebral palsy, the babies are stiff, like one side of the body is stiff, their fists are clenched, and they cannot move that part of the leg. So, so what are the signs in the infant? Because now I'm still in the neonatal and I try to resuscitate these babies. They have a poor head control. As soon as I used to hold the baby, and you can see the head droops down. Only the trunk part of the baby I can hold. I know right away it is a floppy baby. So what should we do? Immediately, these babies need a resuscitation, because most important thing is I have drawn in the next slide. So it's very important, because early intervention during the rapid excuse me brain development, it can improve the outcome of these babies. And that is why lot money has been spent by the federal government all over the United States. I'm sure in your country it must be the same. So we can have a proper resuscitation of these babies. We can follow them during the rehab stage. And I'm going to come to that slide also. So now three types of cerebral palsy. The spastic, I already told you, and spastic time when the baby is rigid, and they another 10% of these babies, they have a athytoid movement, which is like, they might be having seizures or ataxic, difficulty with the balance because of the poor development of the cerebellum. So these are the three types of the babies. These are the three types of the baby's involvement. Cerebral palsy can be mild, moderate, or severe. The mild kind of cerebral palsy in the next slide. Can I have the next slide, please? Okay, so now I explained in this slide, I worked hard to project this slide to see for you guys, what does the baby look like? 0 to 3 months, normal milestone, and compared to the delayed. The 3 months old baby, like you can see, they cannot hold it, their head up, they have a poor grip, and the eye contact is poor. By 3 to 6 months, normal baby will be able to hold head and try to move, but these babies cannot do that. So this is the one from 3 months, 6 months to 1 year. By the by the child is 1 year old, all the clinical features are very distinct in these babies. They have a poor muscle tone, poor feeding, slow feeding, and slow growth and development, and their reflexes overall is very poor. So now I like to share with you a slide where we have the cerebral palsy in a little boy or girl, maybe past 2 or 3 year old. And this is a very good slide that I prepared. So this is the cerebral palsy. You can see either these kids are born, these are the mild, moderate, and severe. In the mild form, you can see one side of the body is involved, the one in the red. Other part is okay. The second one is they become a paraplegic, like both lower extremities, and third part is complete. So these are the different kind, and I tell you, I followed these babies for some time when I was in children's hospital and even during my pediatrics practice. These babies are cute. They have a kind of normal mental, and they are cute babies, but due to this disability, cerebral palsy, they are unable to move, and this becomes very hard for the parents, the caretakers, to take care of the baby. So next slide, please. So what are the risk factor? Yeah, the risk factor why a baby is born with cerebral palsy. As you can see, premature birth, low birth weight, advanced maternal. So these are the factors that affect in the babies the cerebral palsy. Maternal, it has been documented fact, maternal smoking, excess alcohol consumption during the pregnancy, these are a precipitating factor that harms the babies. So those are the risk factor. So now what I did, just to make things very simple for everybody, there is the next slide is the role of early intervention. This is very important because ever since the baby is born, first of all, how they are born with a multiple disability. So how do you start it? Starting from the time they are born, they have a poor vision, they are unable to see well, and their poor grapes. So those so many things. Slow. Feeding is very very slow in these babies, and it takes a lot of involvement. There's a lot of emotional trauma for the parents, for the caretakers when they have to take care of the baby. So the early intervention I have included started from the bottom, proper nutrition, whichever way, um, relieve them, give them enough oxygen, whichever. Some of these babies are there in neonatal just for the oxygen because their brain needs more oxygen. Hypoxia is a good thing. And then the early in the what is our role of early intervention is to maximize the child functional abilities and supporting overall development. The rehab program, very, very important. I have a lot of respect. Physical therapy, adaptive equipment that includes, the infant seat, carrying seat, and all those. Communication support, very important because these parents are so much emotionally upset and they need to talk to somebody else who have the similar situation, and that is very important. Training for their every daily day activity. So what happens, I have noticed some of these babies they improve. Early therapy, they have a improvement in the mobility, independence, and the quality of life. So very important, like I said again and again, early intervention is very, very important. I did visit couple of rehab center during my clinical practice when I had child with a cerebral palsy to see what they are doing. Now, all of them, there are common tools. The recent updates, modalities are these are the recent modalities that we have been using, and I'm sure even in India, there it is all universal, and all of you must be using the same. Combine the two: general movement assessment, the Hammersmith Infant Neurologic Examination, neuroimaging. These are all the early modalities diagnostic evaluation the, that that is being used all over the world. Most of these informations I have gathered from doing doing the research studies that have come out from Australia, from here in United States, John Hopkins Academy of Pediatrics, and also there has been, I think, one or two I remember paper has been reported from India. Often I don't remember which one was it, but in my bibliography, I have included all the informations, everything, because anybody who wants to to know more about this, they can go through my bibliography. So, this manuscript I prepared from my pediatrics aspect. I'm not a neurologist. I'm not specializing in that area. So, as a pediatrician, I request all the pediatricians who are involved with the birth or taking care of these babies should be referred to the neurologist, because from the neurologist point of view, they can have further tests done like a CT scan of the brain, MRI, to determine which part of the brain is affected. So, in addition to this traditional assessment, I went through some other articles written about the rehab medicine. Technologic intervention has become an important part of early care, such as robotics that is coming now, robotics, the virtual reality, neurofeedback, and all this. These are all coming day again and again. I mean, every single day there is advancement in the science, the treatment of these babies. So furthermore, the last one that I reviewed that came up from a study from, I think it was Australia, they are trying the stem cell therapy, to trying to change the genes, the robotic skeleton for mobility, and then lastly, the dorsal rhizotomy, like go back into the nerve fibers that are involved and try to dissect them. So these modalities, what do they do? They improve the motor functions, they reduce the spasticity and enhance independence participation. Cerebral palsy patient, those with mild type, they can function. And I have seen them even, like they going to the school or working in some stores. So from the Disability Act, there has been a lot of things happening, and I do emphasize for the education, because these handicapped kids, they all need a proper education, so they can support themselves. So lastly, I just like to, when I briefly went through all this, and then I'm willing to answer any question according to my ability.
Thank you very much, Niru ma'am.